Good morning. Today we are going to talk about episiotomy and episiotomy repair. Episiotomy is an incision or cut which we are deliberately making during the vaginal birth in the vagina or the introitus. So following the episiotomy, we need to repair the episiotomy for the proper reconstruction of the perineum and the healing process. It has several steps. The repair has several steps which is essential to understand for the proper alignment of the perineum and the support. First, we will look how we can do these steps. Once a baby is delivered, we have to position the mother for episiotomy repair. Positioning usually a lithotomy position or a comfortable position in the bedside. Once a mother is positioned well, we need to clean that area, perineal area, with the normal saline to make sure the aseptic condition. Following the cleaning, we will put a sterile cloth for the draping and make sure the adequate light and the chaperone and the assistant to do the episiotomy repair. Now we are going to talk about what are the surgical equipment is essential for the episiotomy repair. First, we will have a look about the episiotomy scissors. This is the episiotomy scissors which is specially designed to cut the introitus without damaging the anal sphincter. That's why this curve is there. Second instrument is needle holder, which is used to hold the needle. Usually we are using 2020 polyglatin, so we can hold the needle with the help of the needle holder for the suturing. Third instrument is tissue dissecting forceps, which is help to catch the mucosa and muscles layer to facilitate the suturing. Finally, this is a stitch scissors to cut the knotted sutures. Now we are going to discuss about how we are going to repair the episiotomy. Before repairing the episiotomy, we have to make sure the adequate pain relief. If the woman already been on epidural, we can top up the epidural, or we have to give the adequate local anesthesia to the episiotomy area to reduce the pain. This episiotomy is repaired in 3 layers. One, vaginal mucosa, second one, perineal muscle, third one, skin. Now, I am going to demonstrate how we are going to repair the episiotomy. I am going to take this foam block as a perineum. First, I will describe the layers. This outer side, this resemble as vaginal mucosa. Then inside place, this resemble as perineal muscle, and the outside one, this is a skin, and this cross is anal opening. Before starting the repair, we need to examine the perineal area. Importantly, first we have to see the apex of the episiotomy. In addition to that, we have to look at the vaginal tears, cervical tears, and finally we have to do the perectal examination to see any anal sphincter damages. Now I will demonstrate how we can repair these 3 layers. First layer is a mucosa. So the first thing, we have to find the apex. So that is very important to find the apex, and if you have any problem to find the apex, you have to put a sim speculum and expand the vaginal area and clearly find out the apex area. So this is the apex area. Once you find the apex area, you have to start to suturing 1 centimeter above the apex area. So we are starting 1 centimeter above the apex area. So this is a place. First we have to put the knot. We can use the instruments to put the knot. The rest of the thread can be trimmed. Now you have identified the apex and put the knot. To suture the vaginal mucosa, we are using the continuous suturing method to make the appropriate approximation of vaginal mucosa. So we are starting from here to make a continuous suturing without locking. In the same interval, make sure there is no bleeding. Without tightening too much of threads. You have to do that. So likewise, you have to go up to this level, that is a hymenal ring level, which is that vaginal mucosa is attaching with the skin layer. Likewise, we have to continuously put the stitches up to the edge, which is the vaginal mucosa is meeting with the skin layer. Here we have to put a knot and make sure this knot is not too tight, and it should beautifully align with the perineal skin. Then you can see it is without any alignment problem, it will join. So it will facilitate the good healing process and prevent the disfiguration. Once it's finished, you can cut the rest of the threads. Now I am going to discuss about the second layer, that is a muscle layer. This muscle layer usually we can suture with continuous suture or interrupted stitches. Both should be fine, but make sure you are covering whole thickness of the muscle layer and without leaving any dead space, because with the whole thickness of suturing facilitate the proper healing and the strengthening of the perineum, and if you leave any dead spaces, there might be a chance to get the hematomas. Now I will demonstrate how to suture the muscle layer. First we can do a interrupted mattress sutures, like taking one layer and make sure you are not leaving any dead space, and catch all the thickness of the muscle layer. And this is actually a interrupted stitches, and tie that both tightly. Make sure the muscle layers are approximated without any dead spaces, and the rest of the things you can cut. Or else you can put continuous stitches also, like whatever we have put for the vaginal mucosa, to cover the whole muscle layer. So we will start here at the point and put a knot and this rest of this area we have to continuously put and make sure the approximation within this muscle layer. Without locking the sutures, we have to carefully make it approximately. Always make sure there is no dead space. Once everything is there, then you can approximate and cut that part. So make sure that part is now approximate nicely. The third layer we are going to discuss about to suturing this skin layer. That is also we have two methods to do. One is we can use as an interrupted one. So in that point we are using this tissue dissecting forceps to hold this one. So carefully take these edges without taking too much of tissues. So if you take the too much of tissues, then the alignment might not be successful. Then the disfiguration will come. So so this is a interrupted mattress suturing, and put a knot. While you are putting the knot, don't tight too much. Just a good approximation is fairly enough. So cut that one. So there might be some threads might be outside, that's fine. Then again approximate. Second one without catching too much of tissues or skin. Superficially you have to put a interrupted stitches. Cut it the rest of the threads. So now you can see it's aligned nicely, or else you can use the subcuticle banner. That is, of course, you can start it here as a subcuticle. Put a knot. Keep the knot inside and cut the rest of the thread. And this suture will run within the subcuticle plane continuously without too much of pulling. Make sure the subcuticle area not to catch the deep tissues, only the subcuticle. So now see, without any external threads, you can beautifully align the skin layer. So now you can see how beautifully this layer was aligned. So this is a subcuticle method to close the skin layer. The above one is an interrupted one to close the skin layer. Likewise, we have to repair the episiotomy in 3 layers. First layer is a mucosa that we have sutured in a continuous stitches. Second is muscle layer. We can suture either continuous or interrupted. And finally, the skin layer, which we can suture subcuticle or interrupted. Once the suturing is finished, we have to thoroughly examine the vagina and the perineal area to make sure that all the sutures are correctly placed and aligned well, and make sure there is no bleeding or hematoma formation. And finally, we had to do the per-rectal examination again to make sure any other sutures are interrupted through the anus mucosa. After the episiotomy suture, we had to reassure the mother, and we had to clearly document everything in the respective notes. Thank you.